This week is International Brain Tumor Awareness Week. It's an opportunity to draw attention to the symptoms of brain tumors and the treatment and care available. I had the opportunity to speak with a Cadillac neurosurgeon who told me about some of the important signs to look for when dealing with changes in the brain. The brain is responsible for every thought, memory, and movement. So when it's no longer operating as it should, it can be a cause for concern.
It can be difficult because some people come in and say, well, I have a little bit of a headache, it's here or there. And in most scenarios, that is not a brain tumor, as much as people fear that. It's when they have multiple layers of symptoms, headaches with nausea, vomit, with weakness, with numbness, with all these things.
Dr. Andrew Bieber is a neurosurgeon working out of Cadillac's Neuroscience Center in Richland. He says brain tumors can present similar symptoms to those of stroke, and it's important to remember the acronym FAST.
There is the scenario of your face being weak, one side drooping or dropping. That can be from stroke or from tumor. There is arm or leg weakness as one-sided of the body starts getting weak or numb. Those are concerning symptoms that shouldn't happen in most people.
Speech can also be impacted by a tumor, and the T stands for time, meaning it's crucial to see a doctor quickly to identify why you're having these symptoms.
You look back here, this is more the motor areas of the brain, which help us move. So that's why tumors can be so difficult initially to diagnose, because it's not always specific for every patient. Every patient presents.
While brain tumors are relatively rare, Bieber says they do affect quite a few families across the region.
Unfortunately, the prevalence for glioblastomas, which is one of the most fatal, most dangerous ones, is about 3.5 to 4 people per 100,000 per year. Doesn't sound like much, but when you calculate 300,000 in the Tri-Cities region, plus Yakima, plus the areas around, you can get to 400,000 or 500,000 people, which could be anywhere from 15 to 20 cases per year, which is about how many we're treating for just gliomas, just the ones that are the more aggressive subtype.
In Tri-Cities, Cadillac Regional Medical Center provides a variety of supports through the Tri-Cities Cancer Center, local radiation and oncology, support groups, and the Neuroscience Center.
We've been able to beat some of the numbers that the tertiary centers have available, and I think part of that is the personalized care we can provide every patient. Because we're seeing the patient, it's not a team of residents, training doctors, a big system where people get lost. We know our cancer patients.
Which means for many local patients, they can get the individualized care they need right here at home. Dr. Bieber says slow progressing brain tumors are often found around the holidays because family members that haven't been around in a while will notice changes in their loved ones that people who live with the individual may not have noticed.